Very common question asked to me is that we are not in any lecture. What should I read in orthopedics? So we have prepared a list of important topics and mark them with a star wherever you need to see the images on those topics. But before that, I want to talk to you for a minute. One more question asked to me is how to improve your efficiency as you approach the exams. I will explain them with two words, movement and progress. Movement is I've been studying for 10 to 12 hours a day. Progress is how I achieve more today and could integrate and revise. It is not about how much you study, it's about what's the output. At this stage, you have to be very specific in whatever you read, and one or two suggestions which I can give you. Discussions are integral part of your preparation, but at this time, decrease the time on discussions. Only discuss with your colleagues or friends something which is very specific, or talk to the specific teachers if you have an access for any clarity. Also, avoid controversial things because they are rarely asked. Whatever you've been taught, accept that as an answer and go ahead. Second point, increase your time on revision, which is very crucial. Utilize your time. Utilize means I have some study plan for 10 hours a day, study that. But also utilize the time which is your normal routine, like you're traveling somewhere. One of my students during the lunch used to see important videos of discussions. She ended up getting surgery names and she said this made a difference in her preparation. And every day for 30 minutes at the end, please, whatever you have read the whole day, analyze it and extract out what you have to revise in last 7 days. Because what you have to revise in last 7 days is very crucial, because that will give you confidence when you go ahead at the end. Also, amongst this 30 minutes, keep a time frame where you plan what do you study for the next day. Thank you very much. Now let's have a look at the list that we have prepared for orthopedics for PGME. Let's have a look at the list. We are talking about the important topics for PGME in orthopedics. These are not according to chapters, they are according to priorities. When I look at imaging in orthopedics, what do you mean by imaging? Two questions which are asked to me. Number one, sir, what is IOC, investigation of choice? Usually the next investigation. Sir, what is gold standard? Gold standard, usually the best investigation. One of the important things which are asked as images are periosteal reactions. Codman's triangle in the periosteal reaction was one of the most frequently asked questions in NEET 2016. Investigations for stress fractures, MRI. Very commonly repeated question in AIIMS and JIPMER. And osteomyelitis and bone tumors again, MRI. Most of them MRI. If you go with this notion, usually your answers will be correct. Then talking about the other chapters which are in sequence important, imaging. Then infections. In infections, we have to remember osteomyelitis. Infections involving the joints called as pyogenic arthritis. And actinomycosis, which are very crucial. Then tuberculosis of bone and joint. If you don't know TB, it is very difficult to appear in Indian entrance exam. Pot spine. They can give you an image where they can show you two vertebrae, intervening disc, and this is what is important, that tuberculosis is a two vertebral disease. So they can show you a paradiscal lesion in TB, which is a very valuable image that came in NEET. Going further, bone tumors. Bone tumors, the image of giant cell tumor, GCT, is universal. what you must remember, if this is lower end radius and the tumor that goes till the end of lower end radius at the wrist joint, that is GCT till proved otherwise. This is one of the commonest image that has come ever in entrance exams. Malignant bone tumors in which Ewing sarcoma having the onion peel appearance and osteosarcoma with Codman's triangle of sundry appearance is very commonly asked, and bone cyst in which unicameral bone cyst where they show you upper end of humerus is crucial. Next in sequence is sports injury, where they want to talk about ACL and PCL, anterior cruciate ligament, posterior cruciate ligament. The test of ACL have been asked very frequently. This came in PGI May 2017, where out of 5, 3 names were correct as test of ACL. That is the pivot shift test, the anterior draw test, and the ligament test. And about the meniscal injuries, similarly the question came in PGI May 2016. Test of ACL are very, very important, and the test of meniscus, specifically the medial meniscus, which is more commonly damaged, are very important. You should remember the names of amputation, the Symes, Chopard's and Lisfranc's. If you take my view on this, Symes is the most important out of them. Going further, trauma. Classically, when you used to have single exams and you used to have exams being conducted by AIMS, trauma was not a major part. But over the years, the NB board usually includes a lot of trauma. The complications like compartment syndrome, the crush injuries, the fat embolism, the Sudex dystrophy, and the myositis are very important. I can tell you to remember 4 out of them. C for compartment syndrome, C for cast, tight cast, compartment syndrome. F for fat embolism, F for femur, F for 48 hours. Femur fracture 48 hours, fat embolism. S for Sudex dystrophy, S for sympathetic overdischarge. Sympathetic overdischarge, Sudex dystrophy. M for myositis, M for massage. M for massage, somebody had an injury around the elbow. Parents took to an osteopath, the Pahalwan. He did a massage, had a swelling, myositis. So that's what I've told you. If you know this, this is 50% of trauma. CC, SS, MM, FF. Compartment syndrome, cast, myositis, massage, Sudex, sympathetic overactivity, femur fracture 48 hours is fat embolism. Then in upper limb, around the shoulder, dislocations are important. Around the elbow, supracondylar humerus is involved. And around the wrist, Colles fracture is important. You also need to remember the important nerves in relation to the bones in upper limb. Cervical spine injuries, the first to the Jefferson and Hangman, are very, very, very crucial. In lower limbs, if you know dislocations of the hip as compared to the shoulder, more frequently the images are being asked in your exam. Fractures around the hip, specifically the neck of femur and intertrochanteric are images. Also, there are treatments like proximal femoral nail, neck dynamic hip screws are asked to you. For fractures of patella, tension band wearing has been coming for last 2 consecutive aims. Tibia fracture, the bumper fracture image is very crucial, and calcaneum called as the Loveridge fracture is also a very common fracture. Around the ankle, they talk about the fractures, they talk about the nails. I will be releasing a video about the ankle injuries very soon, within 7 to 10 days. Log in to Med Miracle for such videos. This is a very crucial question that is coming to us. What type of ankle injury? What is the pattern of fracture? Then we have got images coming up from the instruments. So they can talk about the interlock nails, the types of screws and how the wires are put. Then you look at avascular necrosis and osteochondritis. These are miscellaneous topics which you don't read in MBBS, but they are hotcakes. They are very, very important when it is concerned with entrance exams in India. Polio, the question came in recent aims about quadriceps being the muscle involved causing hand to knee gait. Disc prolapse, a question came in PGI May 2017 where they had given 5 points out of them 3 were correct. Bursitis, very commonly asked to you where they talk about the housemaid's knee or the clergyman's knee. The inflammatory disorder, the tennis elbow is a key point, and Dupuytren's contracture is a favorite. It's a favorite of aims. Rickets, an image came about rickets showing cuppings, playing and flaring in November aims 2016. Osteomalacia, adult counterpart of rickets, came in PGI May 2017. Osteopetrosis, an image which everybody confused, which actually did not come in the exam in November 2016. Paget's, also called as osteitis deformans, is a universal question. Mind you, you will always have a question from this point. Either osteopetrosis or Paget's wherever you go in India. Osteoporosis is a universal question in India that is asked to you, and the question that is usually asked is calcium phosphate ALP is normal. I want to talk here. Most common fracture in osteoporosis is vertebra, remember, but the most common fracture in elderly is scoliosis, remember. Going to next, the achondroplasia. The dwarfs are very commonly asked about their normal intelligence and good mood. That's the usual question. And osteogenesis imperfecta. That was the image that came in November AIMS 2016, which people misinterpreted osteopetrosis. So you have to look at the images. Osteogenesis imperfecta image came from Pathology Robbins, which is also given in other books. Going to next, arthritis, what joints are involved, what is paired is very classical. RA, ankylosing spondylitis. Ankylosing spondylitis is a universal question. They have been showing you bamboo spine in last 3 consecutive aims, and if you don't know bamboo spine and sacroiliitis, it's very difficult to get it because this is a very important thing. Going to gout and pseudo gout. Great toe inflamed is gout. That's a common question, common image. Charcot's is a destroyed joint. Regarding the upper limb injuries, I am very surprised. Why till now there's never been a question on Erb's palsy, but I'm expecting this as an image to come to you. So prepare Erb's palsy, the policeman or the vegetative deformity, the ulnar, median and radial nerve injuries. They are tests, but remember one golden point. Radial nerve is the most common nerve damage in human body, and practically all the tests in the body are for ulnar and median nerve. So be careful before you mark them. Entrapment syndrome, the carpal tunnel syndrome, and myalgia paresthetica, 2 hot shots, very important. Carpal is involving the median nerve compression, and the test for it are also asked. Then in pediatric orthopedics, DDH, a very rare thing seen in India, but very commonly seen in Indian entrance exam. Perthes, that occurs in 4 to 8 years, is an important cause of a painless limb. And SCFE, slipped capital femoral epiphysis, is a cause of limb in second decade. In diseases of second decades are very crucial for you. CTEV comes as an image, comes as an etiology, comes as a treatment, comes as the classification. Read CTEV thoroughly. And then the deformities in the knee like genu varum and their importance. This is about orthopedics, this is about images. Happy listening. Thank you very much. Please log on to Med Miracle, the YouTube channel, so that you can get the updates of our latest videos. We are preparing the important list of all the subjects which will be soon uploaded. Happy listening. All the best for your exams. Signing off. Thank you very much.